Hello, I'm Kenneth Reese, the founder, owner, and operator of WataugaOnline.com. And we are talking schools again today and the return to more in-person learning for Watauga County schools. The Watauga Board of Education voted unanimously on Monday night to move ahead for the return to in-person instruction for grades 6 through 12 to 4 days a week. That will occur after spring break. To provide more information, today I'm joined by Watauga County School Superintendent Dr. Scott Elliott as we record this on Tuesday morning, March the 16th, during the 11 a.m. hour. Dr. Elliott, long board meeting last night, but a very productive meeting as we continue to move forward with the return to in-person instruction.
Yeah, hello, Kenneth. Good to see you. Thanks for having me back. It was a long board meeting, and we had quite a few people who were live streaming the meeting and following it online. And so I hope that what those folks came away with was that this Board of Education takes these issues very seriously, and they're very analytical and attempt to make very informed decisions based on what's best for our students and their health and safety and education. So I appreciate the board taking the time that an issue like this really deserves. But as you said, after over 2 hours of discussion, hearing from our public health director, hearing from our lead school nurse, hearing from our students and students representing various perspectives of the student body, and after having received a lot of input from parents, the board voted, as you said, unanimously to return all students to Plan A. And, we've been talking about those different plans all year long. It's important to note that the legislature last week passed a law, Senate Bill 220, which we discussed in the meeting at length last night, requiring that all elementary schools offer an in-person Plan A option for students. So fortunately, our Board of Education had already made that decision. As you said, our K-2 students have been in school now for almost a week and a half. We welcome our 3rd, 4th, and 5th graders back this coming Monday. And starting on April the 12th, our middle and high school students will be back, no longer in the 2-by-3, 2-day-a-week model that we've been following this school year. The cohorts will be combined and students will be in school 4 days a week, Monday, Tuesday, Thursday, and Friday.
And I want to back up and give a little context about that Senate bill, or a little bit more information. I need to also say that our local representative, Senator Deanna Ballard, really was a spearhead behind that too. So I want to make sure and give her credit on her extremely hard work on that bill.
Yeah, Senator Ballard is a leader in education in the Senate and in the legislature, and really shepherded that bill through. She had made several attempts at a return to school or reopening bill. It's worth a reminder that many school systems across the state have not been open and operating as we have. I think there was a school system that just started back for limited in-person instruction this week for the first time in a year. So we've been fortunate that we've been a bit ahead of the curve in terms of offering in-person instruction. There were other districts that moved ahead sooner than us, but Senator Ballard really was intent on making sure that every child in North Carolina, even outside of Watauga County, had this opportunity. And the end result was a compromise with Governor Cooper, who has been very concerned about following the health science and recommendations from public health officials, and with improving health metrics and the virus on the decline, and with growing evidence about the safety precautions that we are taking, and the positive effects of students being in school and the negative effects of students being out of school. They came together and decided it was really just time that we move forward with this Plan A option. And after a long discussion last night, that's the same conclusion that our board came to.
And it is also worth noting, this week marks 1 year ago when schools were closed by the directive. I can't think of the exact term right now. The executive order by the governor 1 year ago this week.
That's right. Yep. Saturday, March the 13th, 2020. I'll never forget seeing Governor Cooper speaking to the public, and at that time closing schools for 2 weeks. Our administrative staff, all of our principals, central office directors, met together with me in the afternoon, the Sunday afternoon, the next day. We began to implement the plan that we had been developing for several weeks leading up to that point. That was one And then we pivoted to remote instruction that very next day on Monday. That was 1 year ago yesterday. So I just want to thank our teachers, our parents, our students for all the incredible things that they have accomplished in this past year. It has been difficult, as I said last night. This pandemic has affected people in so many terrible and unfortunate ways, including the limited amount of time that students have been able to be in school. But for the most part, people have worked together, people have supported one another, people have been able to be flexible and navigate the changes. I just want to say thank you to everyone for that.
We talked about the younger grades returning, excuse me, to our listeners if I cough. I've got a frog in my throat today and can't get rid of it. We mentioned the return to school for the younger grades. Last night, of course, dealing with the 6 through 12. That will occur after spring break, April the 12th.
That's correct.
And I guess that's on a Monday. I've not
That's
exactly
right.
looked it up. What kind of questions have you been getting from parents regarding the return, even of the younger kids, but now the 6 through 12 about the return, and what kind of concerns do they have?
All right. Well, as you can imagine, and as you probably know, we've heard every possible perspective it seems there can be about school operations this year. And it just speaks to how differently this pandemic affects different people and different families. From the families and children who have been able to not just adapt, but actually have thrived in some ways through remote instruction or making changes to the schedules in their lives, to the families that really have been nearly devastated, either because of the health impacts from the virus or the economic impacts, or because of the different ways that children learn. So the feedback and the concerns that we've heard are quite varied. And it's not just because people have different opinions, but because of how differently this whole situation affects individual people. And I'm very empathetic and sympathetic to that. More recently, there was significant feedback from parents about encouraging the board to take advantage of Senate Bill 220 and the opportunity to move to Plan A. And that there have been many parents throughout the school year who have been flexible and patient and understanding of our very sort of safe and measured approach to all of this and keeping things in balance, but who felt strongly that it is time to increase student attendance at school, and that SB 220 gave us that chance. So we heard a lot of feedback from parents about that, but we also heard feedback from parents, and I've heard some today from parents who have real legitimate concerns about the timing and about the safety factors. And so we could talk about that for a little bit. I just want to acknowledge.
I wanted to ask you how so, like what safety concerns, if you can address those.
Sure. So, there are some folks, parents who've taken extreme and appropriate precautions with their families. They've not traveled. They don't go outside the home very much. And the 2-day-a-week schedule with half of the number of students there at school felt like a safe and measured approach. And so now the idea of bringing roughly twice as many students back to school now feels a bit overwhelming. And at every point along the way that we've made these changes, there's been anxiety and fear and uncertainty about what these changes might mean. So it's understandable. This is one of the biggest changes that has occurred this year. Specifically, the concern is about the number of students that will be in school and whether or not we'll be able to maintain appropriate social distancing. And we've messaged and we've reinforced and worked so hard to emphasize this 6 feet of social distance recommendation that was required in Plan B from the state DHHS, that it's now hard to envision or get our heads around something less than that.
And let's talk about that for a second, because our viewer may not be familiar with some of these changing guidelines from either a DHHS or the CDC,
right.
Center for Disease Control in Washington, because they are changing their recommendations, or I don't want to say a mandate, but
the guidelines.
Yeah, the guidelines. Thank you. From 6 feet to, I've heard 3 feet.
Well, so there are a couple of things about that, Kenneth, and it kind of does get to the concerns that some parents have about the number of students that will be back in school and how safe is it for them to be close together. So just a real brief history of this, not to bore people, but there's been a lot of research for months now. I began hearing this back in October of last year, that the World Health Organization, based on school reopening in other parts of the world, we're finding that that 3 feet of distance, or roughly 1 meter of distance between people when stationary, so think about seated in a classroom, was provided the same level of protection as 6 or more feet, or roughly 6 feet, I should say. So the CDC has not adopted that guidelines to this point, but the North Carolina guidelines did recognize that, at least for children ages 10 and younger, that minimal to no social distancing seemed to have no impact on children getting the virus. But now the research, though, is showing that even with our older children, that at least 3 feet of social distance provides the same amount of protection. There was a study that was released last week out of Massachusetts schools that were operating with all different levels of attendance and social distancing requirements. And those that had minimal to no social distancing had no statistically significant increase or difference in number of transmissions in schools than those that were following 6 feet. Okay, so, but still, I want parents to know we will make every effort to ensure as much distance as possible, because we know that that's one of the factors in helping to keep our students safe. But distance alone is not really the magic wand,
Right.
keeping our students safe. So I do want to touch on what some of those things are. So I know it's getting old, but wearing masks and being vaccinated are the 2 things that will help to protect us from getting the virus and spreading it to other people. And just because someone is vaccinated doesn't mean that they can't still spread the virus to other people, is what we are being told. We still have the mask mandate in place for every staff member, every student, every visitor to the building, and to any of our events and activities, from football games on Friday nights to coming to the school to drop something off or coming to class, must wear a mask. Okay. We're very pleased that our staff members are working through the process of getting vaccinated. March the 26th, our staff members, most of them, will get their 2nd vaccine and will be fully vaccinated 10 days after, on Monday, April the 5th. That's huge. Proper ventilation. So, with warmer weather hopefully coming now, we get past this week, we're hopeful for warmer weather, and windows being able to be opened, doors being able to be opened. We've installed HEPA filtration systems, or portable HEPA filters, in many of our classrooms. We have over 100 of those out in classroom spaces that have poor ventilation. We've even provided our staff members with portable personal ventilations, air purifiers if needed. And 4th, keeping sick children at home. So if we keep sick children at home, we increase ventilation to the extent possible, we wear our masks, and we social distance to the extent possible, I truly believe that our schools are safe for students to be in school. As you and I have talked many times before, here we're making this decision about middle school and high school students. You and I both have middle school age daughters. I have a high school age son. These decisions directly impact our family. I would not be supporting this decision if I did not think it was safe for our children to be back in school.
Yeah, and I can very well see the concern that some parents may have about bringing everybody back in together, because in one way it does seem all of a sudden. But then again, as we mentioned a little bit earlier, it was 1 year ago that schools were closed. I mean, we are moving forward, and the return for the younger kids, that so far that has been, younger children, I should say, has been successful. And this is just another step in getting everybody back into school. I have mentioned before that, with the Watauga school system, we've been lucky that our school system did not have to close. And Watauga County has done a great job on all levels, from the university folks to those of us that live here to educators, of wearing our mask, keeping our distance, and keeping the virus spread as low as we could here in the county.
That's right. That's right. So I want to thank the community for doing that. A healthy community means healthy schools, and we can't stop doing those things. I know we want to, and the end is in sight, but we're not there yet. If we want to keep our schools open, if we want students to be able to return to school, we must be able to continue to do those things, and especially outside of school. So Kenneth, just as we've seen little to no secondary transmission in school. We saw some earlier in the school year. More recently, we have not. But we still are seeing, even in small numbers, students and staff members who are becoming COVID positive outside of school. Significant numbers of students, when they are COVID positive, or I should say, of our COVID positive students, a significant number of those become infected through contact with other family members outside of school. So again, parents, we have, I think, an obligation to do what we can in our lives and our work and our social circles and going to the grocery store so that we can keep ourselves safe, so that we can keep our children safe. And that's where the vaccine comes into play. Kenneth, you heard Jen Green say last night, there are plenty of vaccines available for everyone who qualifies in group 1 through 4. So, and that includes our high school students, ages 16 and 17-year-olds who have one of those qualifying health conditions can go get a shot, and adults as well, or frontline workers. If we have students or adults who work in grocery stores or restaurants, I believe they qualify for that. And hopefully it won't be long that we move to phase 5 for everybody else.
I'd like to also mention from the meeting last night, and I don't know if it was you that mentioned this or if it was Jennifer Green that mentioned it, but the rapid test, should they be needed, the school system has over 1,400 rapid tests available. There again, should they be needed? That to me is very significant.
It is. We have about 1,400 of those on hand. We're administering them to as many people as who need them. I wanted to just show my support for that process and got a rapid test myself a couple of weeks ago. It was quick, it was easy, it didn't hurt. It's a less invasive test. Children have been tested and tested well. And I want to say there was an article that came out over the weekend that quoted a researcher from Brown University who said that ventilation, masks, and the vaccines for staff and testing of potentially sick or even asymptomatic students in school is the key. Didn't even mention the social distancing, which we are going to attempt to do. I want to say, Kenneth, that I think that a lot of the concern is centered, especially at the high school level. With our K schools, even adding the middle schools back,
Yeah.
the numbers are still pretty small, but it's a pretty jarring change at the high school level to bring twice as many students back when you have about 1,300 students attending in person. We still have about 200 students in our virtual academy. So I do want to just touch on some of the safety precautions that are going to be put into place over there. I was over there this morning. Dr. Blanton and his team are working on adding an additional lunch shift. They have 4 lunches right now. They'll be adding a 5th lunch and stretching out the 3rd period block so that there are not as many students altogether at one time. They'll be adding seating. If anyone's been in the high school recently, the whole commons area, the entryway, by the stairwells, throughout the cafeteria, we've put in additional tables and seating to be able to spread students out. Hopefully with good weather, we can expand on those senior lunches and let more students go out into the courtyard and have their lunches. We'll also be working on the class changes. So we get those times in between classes when there are more students out in the hallways and come in closer contact with each other. We're less concerned about that passing contact, that short-term contact, but still it'll be a lot of students. We're talking about staggering the release times of those classes so that not all of the classes are changing at one time. And I would encourage any students or parents who may be concerned about a student being out there in the hallway during that time, just ask a teacher if you can wait a few minutes until the halls clear out or until the class change is made, and then make the class change, and that next class teacher will certainly understand. And then something that we see a lot of students doing, and that is double masking. We see that our cloth masks and our surgical masks or disposable masks each have around 40 to 42% efficiency with the COVID-19 or the SARS virus. Putting them together doubles that protection. With even minimal social distancing and double masking, a public health official couldn't put a number on it to me, but that essentially is as much prevention as you can have, short of having the vaccine, of not getting sick. So I think it will be a change, and then it will feel like there are more students there, because there will be. But I think the trade-offs are that we're going to be able to double the amount of time that students will be in school with their teachers. Students will not be falling as far behind. Students will be able to make up time. And while we know that there will be some anxiety for students returning to school, we already know for sure the physical and mental health impacts that many students have experienced by not having a regular school routine. And as you said earlier, we're kind of inching back towards normal, and we think that this is a good way on the 4-day-a-week schedule to ease ourselves safely back into that.
I won't keep you much longer here because I know you've got a lot going on today and the rest of the week and month. You were talking about the staggered lunch schedules, et cetera, for the high school. How does that play in on the elementary level? I know in my daughter's class, she's in 7th grade. I guess they started in 6th grade. They would go to different rooms like you do in high school. How is that being worked out for like the 6th, 7th, and 8th graders?
Well, much like it has been since students came back in Plan B, our children have been eating their lunches in their classrooms with their teachers, and also at times having lunch in the cafeteria, though with the smaller groups, it was more possible to eat in the classrooms. For the most part, in K-5, the students are eating in their classrooms. And even, our children in 7th grade have been eating in their classrooms. Now with more students coming back, and it differs by school. As you know, we have really small schools and some really big schools, and some of the big schools have some of the smaller cafeterias, and that the schools have just gotten really creative about how to spread the students out, finding other spaces for students to sit, or maybe taking half the class to the cafeteria while half the class is still in the classroom with the teacher, things like that, in order to try to ensure that students have as much social distancing as possible.
And I guess it will also help too, even though it's different teachers, excuse me, the teachers for like the 6th, 7th, 8th graders, 5th graders, they will have already seen what the K through 2, 3, 4
That's right.
have done, are doing, and then they can adapt from there as well. So
That's
it's
right.
it's not just a free for all.
And I want to, remind folks that a lot of this planning was put into place last summer when we thought that we might be starting. We didn't know how the school year was going to begin,
Yeah.
or whether or not we would start on the Plan B. So a lot of, how do we keep kids separated in the hallways? How do we exchange classes? How do we manage PE and recess and the
Being in the
beginning of the day?
library.
Yeah, the beginning of the day, the dismissal at the end of the day, but also say we've learned a lot since then. We know a lot about how the virus does or does not spread,
Yeah.
but we also know that we can anticipate things that we didn't anticipate. And that's why I appreciate the Board of Education recognizing the slow, gradual phase in of these changes and to give people time to adapt.
All right, let's recap these important dates one more time as we conclude this conversation. Again, we are recording this during the 11 o'clock hour on Tuesday morning, March the 16th. Last night, Monday night, the Board of Education unanimously voted for the return of grades 6 through 12 to 4 days a week in-person instruction. That will begin after spring break. So this week, the K through 2 started back 4 days a week. On Monday, this coming Monday, 3 through 5, we'll go to 4 days a week.
Great job.
I had to stop and think about that in between trying to muffle a cough too. And then, so then we have spring break when April
5th through the 9th.
5th through the 9th. And then 6 through 12.
That's right.
We'll go back on the 12th to 4 days a week. Again, Wednesday being the only day that schools are not open for
in-person
excuse
instruction.
me. Thank you.
I do want to mention, you did a great job there, Kenneth, of running down the dates. So I would just, as a reminder, mention that the week where Friday, March the 26th falls, Friday of that week is March the 26th is the day that our staff members go for their second shot.
Yeah.
And so the Wednesday of that week will be a student day.
That's very important to know.
Yep.
Yes.
So we're essentially swapping the Friday and the Wednesday that week. And that doesn't impact our 6th through 12th grade students, but it by that time will be important for our K-5 families to know that week school will be Monday through Thursday. The middle and high school students will still go to school in their cohorts Monday and Tuesday. The other cohort will go Wednesday and Thursday that week, so our staff can get their vaccines.
And of course, communication will be sent out to remind parents and guardians of that week, before that week, that Wednesday will be a school day, Friday will not. And again, that's March the 26th. So, yeah. All right. Well, a lot of good information there. Anything else you can think of we need to touch on? I think we've hit on it all. I mean, it is a nervous time for everyone, but it is an exciting time, I think, for most everyone, or should be. as we all try to get back to and I hate this term new normal, but that's really what it is.
That's right.
And
So as you know, I always like to thank people, thank everyone
go for it.
for their hard work. I always praise our teachers, but I want to give a special shout out this time, Kenneth, to a group of folks whose work is so important but often gets overlooked. That is our school custodians. Our school custodians are the folks that are doing the sanitizing. They're the ones that are marking off the floors in terms of the social distancing. They're the ones that go into classrooms and clean if we ever find that we have someone who was there and who was sick. They're there early in the morning, late in the evenings. They're unsung heroes. A little place in my heart. My first job was as a custodian, so I know the hard work that they do, and they're really behind the scenes making sure that our schools are clean and safe. So I want to say thank you to our school custodians.
Yeah, I don't blame you. That hat's off, a tip of the hat to those folks for sure. All right, well, that wraps it up. We will we'll touch base with Dr. Elliott again here in just a couple of weeks. Hopefully, maybe right around the time that 6 through 12 is starting to go back. That way, we will have gotten a good handle on how K through 5 has been doing, and as we continue to move forward. My thanks again to Watauga County School Superintendent Dr. Scott Elliott for his time today. I'm Kenneth Reese, the founder, owner, and operator of WataugaOnline.com. Hope you folks stay safe. Thank you for your time, and we'll talk to you soon.